Hello and welcome to my channel. In this lecture we're continuing our discussion about the posterior abdominal wall, and this time we'll talk about the fascia and muscles of the posterior abdominal wall. So let's begin. On the posterior abdominal wall from the back, there is the thoracolumbar fascia. The thoracolumbar fascia, it has a thoracic. It's attached to the back of the thorax and the abdomen in the lumbar region. In the thorax, it's attached to the spines of the vertebrae and the supraspinous ligament, and extends laterally to the angles of the ribs. The angle where the rib changes its direction from going lateral to going anterior and inferior. You can see part of it here, but not in this region because it's anterior to the muscles connecting the vertebral column to the upper limb. While in the lumbar region, it's more sophisticated than that. It's composed of three laminae. Posterior lamina to the supraspinous ligament and spines of the lumbar vertebrae goes laterally and covers the erector spinae muscle, as you can see here. The middle lamina comes from the tips of the lumbar transverse processes and the intertransverse ligament, the iliac crest and the lower border of rib 12, and goes laterally behind the quadratus lumborum muscle and meets the posterior lamina at the lateral edge of the erector spinae. The anterior lamina is attached to the anterior surface of the transverse processes of lumbar vertebrae and goes laterally from lower down. It's attached to the iliolumbar ligament, the iliac crest, and high up it's attached to the lateral arcuate ligament we talked about when we were discussing the diaphragm. Now all these laminae converge to the lateral side and unite to form the fascia, from which the muscles of the abdomen takes origin, like mainly the transversus abdominis muscle. So this is the arrangement of the fascia of the posterior abdominal wall. Remember, it has a thoracic part and a lumbar part. Now for if you go down, and in the ventral aspect of the posterior abdominal wall, means this region, there is the Iliopsoas fascia. The Iliopsoas fascia, from its name, it covers the iliacus muscle and the psoas major muscle. The part covering the psoas major thickens superiorly as the medial arcuate ligament, not with an N, with an L, medial arcuate ligament. Remember that when we discussed the origin of the diaphragm and the vertebral bodies. And it forms arches because the vertebral bodies are concave from the sides. They don't go straight down. They are concave from the sides, and it forms arches, from which, by the way, arises the psoas major muscle as well. And medial to these arches pass the lumbar arteries and the branches going to the back of the psoas major muscle. Laterally, above the iliac crest, it blends with the Quadratus Lumborum fascia, and below the iliac crest here in this region blends with the iliac fascia. So here it blends with the Quadratus Lumborum fascia, as this is the Quadratus Lumborum muscle, this is the fascia covering the muscle, and the iliacus with the iliac fascia, it joins or merges or blends with the psoas fascia. Now part covering the iliacus muscle, the iliac fascia, attaches to the iliac crest and the pelvic brim down there, the pelvic brim, the upper margin of the true pelvis. We will discuss this in the pelvis. Nerves lie behind it You have to remove the fascia to uncover the nerves, like the femoral nerve in this example. This is the lateral femoral cutaneous nerve here, is well shown. This is the lateral femoral cutaneous nerve. So the nerves behind the fascia, while the vessels at front of the fascia. Okay? Remember this. The muscles of the posterior abdominal wall, we have the Quadratus Lumborum muscle, we have the psoas major muscle with the psoas minor, and the iliacus muscle, and that's it for the posterior abdominal wall. Now for the Quadratus Lumborum muscle, you can see it's broader below than it is above. See that? It has an oblique margin here, and it attaches to the medial side of the lower border of rib 12. Rib 12, the medial side of the lower border, and inferior to the iliolumbar ligament that extends between the transverse process of L5 and the iliac crest, and to the iliac crest, and to the tips of the upper four transverse processes of lumbar vertebrae. So all the way from here upwards till the medial part of the lower border of rib 12. Now it looks like it acts on rib 12, and this is exactly its action. It's not to depress the rib 12. No, it's to stabilize rib 12 during the descent of the diaphragm. Remember, the diaphragm takes origin from rib 12, and when it contracts, it descends. So when it descends, a counter movement of the rib should occur, that it goes up. So instead of going up, the quadratus and wastes the function or wastes the action of the diaphragm, the Quadratus Lumborum muscle pulls on it and fixes it, stabilizes it during the action of the diaphragm, so the diaphragm descends completely with the maximum performance. Okay, so this is the action of the Quadratus Lumborum muscle. Now the nerve supply of the Quadratus Lumborum muscle is T12 nerve, which is the subcostal nerve, and the upper four lumbar nerves branches from the spinal cord segments, lumbar spinal cord segments. So it's rich in nerve supply. Actually, it's an important muscle for the action of the diaphragm. Indirectly assists the diaphragm in its action. The psoas major muscle is long and fusiform, as you can see here, and attaches to the surfaces of all lumbar transverse processes, the anterior surfaces, attaches to the discs between vertebra, starting from vertebra T12 till the disc between L4 and L5, that's 5 digitations, and from arches bridging the concavities of the lumbar vertebrae. And medial to these arches, I told you, passes the lumbar vessels and the sympathetic rami that pass behind the psoas major muscle. By the way, with this attachment, with this origin, it occludes actually the intervertebral foramen. So any nerve coming out of the intervertebral foramen must find itself in the substance of the psoas major. If you dissected the lumbar plexus before, you have to cut the muscle fibers, dig deep in the psoas major, in the substance of the psoas major, to find the beginnings of the lumbar plexus of nerves. That's where you can find. So the nerves emerge from the muscle, as you can see here. See the nerves emerging from the muscle, like the femoral, like the lateral femoral cutaneous, like the iliohypogastric and ilioinguinal. We'll talk about that. Below, lower down, it receives the iliacus muscle laterally. Iliacus muscle laterally. This is the iliacus muscle, and pass anterior to the hip joint. As you can see here, it goes down to insert itself in the into the lesser trochanter of the femur, by which it pulls on it to exert, a lateral rotation and flexion at the hip joint. Of course, this is muscle passing in front of a joint, so there should be a bursa between it and the joint to guard against friction against the capsule of the hip joint, the iliopsoas bursa. Actually, you will study this with the lower limb, and it's one of the bursae that communicate with the inside of the hip joint, and we will talk about this later in the lower limb. Relations of the psoas major are important. Anteriorly, both muscles related to the kidneys, as you can see here, of course covered by peritoneum, kidneys with their renal vessels, the psoas minor muscle, you can see, you can't see it here, the psoas minor, in other plates you see it. The ureter, as you can see, the ureter descending on the psoas major between the genitofemoral nerve and the gonadal vessels on both sides. Anterior also on the right side, there is the psoas major is related to the inferior vena cava, don't forget that, and coils of ilium. Anterior on the left side, it's related to the descending colon. So descending colon on the left side, and coils of ilium and inferior vena cava on the right side. Posteriorly, related to the transverse processes, of course, from which it takes origin of the lumbar vertebrae, and it's related also to the edge of the Quadratus Lumborum, as you can see here. This is the Quadratus Lumborum muscle. Medially, related to bodies of lumbar vertebrae, from which it takes origin, and the lumbar vessels which pass in the arches formed by the origin of the muscle. Anteromedial border is related to the common iliacs, then the external iliac, as you can see here. This is the common iliac. Then the external iliac vessels and aortic lymph nodes and sympathetic chains. This is the anteromedial border of the muscle. And deep inside the muscle, as I told you, there is the lumbar plexus of nerves. So the relations are important, and you should know about them, because it's a good topic for questions in exams. The relations of the psoas major muscle. The structures emerging from the muscle. From the lateral border, we have the iliohypogastric nerve, we have the ilioinguinal nerve, the lateral femoral cutaneous nerve, here the subcostal, this is the iliohypogastric, this is the ilioinguinal, and the lateral femoral cutaneous nerve, and the femoral nerve, as you can see here. Now, on the muscle, there is the genitofemoral nerve. You can see this nerve that divides into two branches, a genital branch that goes into the inguinal canal, as we talked about it before, and the femoral branch that supplies the upper medial thigh, the skin, genitofemoral nerve. Going medial to the muscles, we have the obturator nerve, accessory obturator nerve, and the lumbosacral trunk. See, all these nerves emerge from the substance of the psoas major. Again, we have the iliohypogastric, the ilioinguinal, the lateral femoral cutaneous nerve, femoral nerve, then on the muscle, genitofemoral nerve. See, it emerges from the substance of the muscle anteriorly, or some books describe it as anteromedially. And then medially, we have the obturator nerve and the accessory obturator and the lumbosacral trunk emerging from the medial border of the muscle. Now, for the action of the muscle, together with the iliacus, it exerts flexion and lateral rotation at the hip joint, and the nerve supply of the muscle by the upper three lumbar branches from lumbar spinal cord segments of the lumbar plexus, L1, L2, and L3. Okay, this is for the psoas major. It's called the loin muscle. The loin muscle. Okay. When you do an exercise that involves flexion at the hip joint, you feel the deep pain after the exercise. The deep pain comes from this muscle, the psoas major. The psoas minor muscle, it's present in 40% of people. It's not it's not in all individuals. If it exists, it arises from T12 and L1, and simply merges down with the tendon and fascia of the psoas major muscle. So it's an occasional muscle, not in all of us. The psoas minor. The action you can't. It assists the psoas major, of course, in its action, and the nerve supply is L1. The iliacus muscle, see, this is the iliacus muscle, arises from the upper 2/3 of the iliac fossa. Now, there is a question to you, for you. Why the upper 2/3? Why not the whole iliac fossa? Well, if it arises from all of the iliac fossa, it won't be able to contract. So it arises from the upper 2/3 of the iliac fossa to give space for it to contract. Okay, it goes down, passes behind the inguinal ligament and goes to the thigh, joins the psoas major muscle, and inserts into the lesser trochanter of the femur. So the action of the iliacus is the same like the psoas major, by which it exerts lateral rotation at the hip joint and flexion at the hip joint. Okay, and of course the bursa is called the iliopsoas bursa. It's behind both muscles and between them and the hip joint. Remember these as two important anterior relations of the hip joint when we study the hip joint in the lower limb. Okay, relations of the iliacus muscle. Anteriorly on the right, we have the cecum, the peritoneum, and the lateral femoral cutaneous nerve. See, this is the lateral femoral cutaneous nerve. And here we have the cecum. Here we have the descending colon, and of course on both sides we have peritoneum. Also the lateral femoral cutaneous nerve. Okay. We have iliohypogastric and ilioinguinal nerves and femoral nerves as well, anterior to the muscle on both sides. Posteriorly, there is the iliac fossa, of course, the one that takes origin from, and medially related to psoas major as it joins the muscle to its destination, to its insertion in the lesser trochanter of the femur. Of course, it's covered by iliac fascia, with the one we talked about, where the nerves are behind the fascia and the vessels are in front of the fascia. Now the action of the muscle with psoas major, flexion and lateral rotation at the hip joint. The nerve supply is femoral nerve. Don't confuse this with the psoas major. The psoas major from lumbar nerves, direct lumbar branches I mean, and the iliacus muscle from the femoral nerve, which is a lumbar nerve too, but from the femoral nerve. And together, because of their insertion in fracture neck of femur, the thigh is rotated laterally. The muscles and fascia of the posterior abdominal wall are simple and easy to learn. Do your best in studying them. I hope you got the maximum benefit from this lecture, and thank you very much for watching.